Four Oaks, success isn't just a goal, it's the essence of our vision to expect success. From our community-based services, including in-home support and after-school programs, to our residential treatment programs and foster care services, Four Oaks touches the lives of children and families in all 99 counties. With your commitment, we will continue to support our communities across the state for many, many years to come. Thank you so much for your support.
Welcome to Iowa Ideas. Thank you everyone for tuning in. This is our 9th year of Iowa Ideas, an event that explores topics that are important to Iowans, like our wonderful topic today in this session. We're excited to have 2 great days of discussion on the pressing issues facing Iowans. We're a few sessions in now, and I hope you've been able to tune into some of our morning sessions. Before we get started, I'd like to thank our sponsors for this Iowa Ideas event. Our presenting sponsor for the entire event is ITC Midwest, and our track sponsor for the Human and Social Services track is Four Oaks, who we just saw the video for them, and we're very grateful for their support. The support from our sponsors helps to make this whole conference something that we can do free for everybody. So we're really glad of that financial support that they give us. So to our audience members, I want to let you know that as we go through our discussion today, we will have things open to receive questions. So you can put those in the Q&A box or in the Zoom chat, and someone will be sending those to me, and we'll be able to just bring those up to our panelists. So if there's anything that's discussed that you find interesting that you want to hear more about, or if there's any thoughts that you have for our panelists based on their situation and expertise, then please let us know, and we'll try to tie that into the conversation. My name is Emily Anderson. I am the public safety reporter for the Gazette, and today I am the moderator for this session. This is our third session in the Human and Social Services track today about food insecurity remaining an issue in Iowa. So we have some wonderful panelists who are prepared to talk to us about this subject today. I'd like to just invite each of them to introduce themselves. If you could each tell us your name, your affiliated organization, and how long you have been working in the industry. So John, if you want to start us off.
Sure. Thank you, Emily. Great to be here. John Bowler. I'm Executive Director of the Coralville Community Food Pantry, and I've been with that organization for 13 years now. And I've also been on the board of the Iowa Hunger Coalition for 5 or 6 years, I think, and grateful to share that opportunity with Luke, who's also on today.
Absolutely. Luke?
Hi, my name is Luke Elzinga. I'm the Policy and Advocacy Manager at the DMARC Food Pantry Network in Des Moines. And I've been there for 11 years and also serve on the board of the Iowa Hunger Coalition and work with the Iowa Food System Coalition as well.
Absolutely. And Kim?
Good morning, everybody. My name is Kim Guardado. I'm the director for the Food Reservoir at HACAP. We're the food bank that serves eastern Iowa, the counties and surrounding Cedar Rapids and Iowa City. I've been with the food bank now for 7 years, but I've been with HACAP for 23 years. I also serve as the chair of the Iowa Food Bank Association, which is the association of food banks, the 6 food banks that serve the state of Iowa. So thank you for having me.
Absolutely. We're glad to have all of you. I think this is going to be an awesome discussion today. So looking generally, we've got kind of the description of this session was about how food insecurity has just continued to grow. You know, we listed a whole bunch of numbers in that description, data that we have been able to track as far as the difficulties that are popping up in this field, in this area. So to start off, let's get a little bit of background about where we're at right now in the space. So if you could give us a brief overview, kind of whoever wants to jump in, just what are the food related, funding cuts and the difficulties that you're seeing this year? I know there are some federal, statewide sorts of cuts that have jumped in. So tell us a little bit about what you've been facing.
Well, I guess I'll go ahead and start from the food bank perspective. Certainly the government shutdown is of concern that, is top of mind for everybody, I think, right now. Some things that I just wanted to make sure and note is that for a short-term shutdown, it doesn't really have any effects on the amount of food coming in to the food bank. Folks in Iowa should be able to get their SNAP benefits as usual. The WIC clinics continue to be open, and I think food pantries around our state, continuing to serve people and be available. I think one of our concerns certainly is that if that goes into kind of a long-term shutdown, then that would have more longer-term effects on the amount of food that we're getting from the USDA and benefits for individuals directly. So that's certainly kind of something that is something that we're all thinking about today, especially. I will say that over the last I would say the last year has really been especially challenging. We're still continuing to see the need at the levels that we were during COVID. We didn't really see a day that things went back to normal. We've just continued to see that need increasing. People that are visiting, whether it's one of our partners or one of our mobile pantries, we just continue to hear the stories from individuals that are having to reach out for the first time, having to ask for help and to look for food that haven't had to do that in the past. And so that just continues to concern us as we see, the prices continuing to increase, difficulties in being able to get large amounts of food, and some of the changes that have happened within the USDA foods. We're seeing a little bit less food than we had previously. So thinking about that rising need as well as decreasing resources to be able to meet the need is certainly why this is a topic that remains important for us to discuss.
Absolutely.
Go ahead, Luke.
I thought I saw you unmuting. Well, maybe I can cover some of the federal stuff we've been seeing. Kim kind of mentioned that this has been a very hard year, and certainly a reduction in some of the TFAP food we saw from USDA canceling, not all TFAP food, I want to be clear, but a significant portion that was purchased through the Commodity Credit Corporation at USDA. So, that means less food going out to food banks and food pantries. Then we also saw the cancellation of the LFPA, the Local Food Purchasing Assistance Cooperative Agreement, and LFS, which is Local Foods for Schools. And they were going to do child care centers as well with this more recent round. That was canceled. And so that was about $11.3 million worth of local food purchases over the next 3 years for Iowa that we're not going to be seeing available for food banks and schools as well. And then the really big thing, I think, is the reconciliation bill, HR 1, the one big beautiful bill, whatever you want to call it, that was passed and signed into law on July 4th. That is the largest cut to SNAP in the history of the program. And we can get into a little bit of what are the near-term consequences, what are the more long-term consequences of that. But there were some really structural changes made to the program, how it's administered by states, and also really some pieces that are going to cut down on eligibility. So there's less people who are going to be qualifying for SNAP. And, in Iowa, we're kind of at a dynamic. We've seen some SNAP numbers come up a little bit, but we're still basically sitting at a 17-year low for SNAP enrollment. And so when we've got food banks and pantries, continuing to see historic need, and we know that SNAP enrollment is likely only going to drop further from these changes, I think that's a real concern.
Absolutely.
And I'll add too, like in the midst of this just explosion of need in our communities across the state of Iowa, more is being asked of food pantries and food banks. One example is the Healthy Kids Iowa program, which I'm sure we'll talk a little bit more on, but I would just love to share some input on what that looked like from the front lines. So for those not familiar, Healthy Kids Iowa is an alternative pilot program instituted by the state of Iowa, designed to supplant and replace summer EBT. And despite warnings and pleading from anti-hunger advocates and people with lived experience for the past couple of years, our governor's office and HHS decided to move forward with an unproven program to replace what was a proven, efficient, effective program when it comes to childhood nutrition benefits and ensuring that kids have access to food they need to thrive in the summer. And so this was a huge credit to our food bank. They worked their butts off this summer. Food pantries across the state were working incredibly hard. We all decided some food is better than no food, even though in our minds we knew that this program was designed in a way that just wouldn't be nearly as effective as summer EBT, which would have covered 245,000 kids in Iowa for nutritional benefits in the summer. And I can just speak from our experience in Johnson County. We partnered with close to a dozen nonprofit organizations, 3 municipalities, about $25,000 worth of in-kind support through labor and equipment. And again, had our best people on it, had 3 distributions, took a village to do it. Despite all that heavy lifting, we served just a fraction of the kids who would have received summer EBT benefits, maybe 15 to 20% total. So again, that's really exhausting and disheartening when, again, we're incredibly busy. We're breaking records at the Corvo Food Pantry. We're on track to distribute 1.3 million pounds of food this year. We're all hands on deck, and to have to be sidetracked with a program that again is not nearly as effective as what was already in place was quite infuriating. And so my messaging has been it shouldn't be this hard to feed kids, to feed families, and feeding people, feeding Iowans doesn't need to be a political game.
Absolutely, yeah. So you kind of went over some of these impacts that you're already seeing from those various changes that you all mentioned, statewide and federal impacts. What are you seeing? And I know it's impossible to predict the future, obviously, but what are you, as you're planning ahead with your organizations, trying to figure out what you're going to be doing in years to come, what are you expecting to see as the long-term ongoing impacts from some of these changes?
I'll jump in real quick. Just some of the things that are keeping me up at night, just what we're seeing on the ground at the food pantry. We're seeing now every day that we're open, anywhere from 5 to 10 new registrations for families who've never been to our food pantry before. That doesn't feel sustainable. Like a lot of food pantries in more well-resourced communities throughout Iowa, we're seeing a lot of families coming from outside of our service area and some of our neighboring rural communities coming to Coralville, North Liberty, Iowa City, Cedar Rapids, to get the food they need because either the economy's hitting them too. Their local food pantry, which is run by volunteers, doesn't have the bandwidth and capacity to meet the extensive need that we're seeing right now. And so they're turning to, again, food pantries like ours. We're doing the best we can to support them, but people are driving 30, 45 minutes up to an hour to get the food that they need. And that's just not okay. And again, just like looking ahead as a director of a nonprofit organization, we're pretty well resourced. But looking into 2026, knowing how hard that's going to be as we keep seeing this explosion in need, and how are we going to afford all the food? How can we keep our staff paid and supported? So those are, again, things that are stressing me out.
Absolutely. Luke, Kim, do you have any thoughts on just looking forward?
Yeah, I would echo what John said. I certainly, having conversations with donors about how can, from a philanthropy perspective, how can philanthropy support the work that we're doing in ways that remove some of the barriers for smaller partners or those without paid staff to be able to apply for grant funding. So just really kind of talking about what that looks like and how we can work together to share the need so that we're not necessarily competing with each other for funding, but be able to work together to find the best ways to use funding that is available in our community. I think that's a piece of it. Also, looking ahead to some of the work requirements and volunteer requirements that are there that we'll see with the SNAP program is making sure that we're positioning ourselves as a place where people can go to volunteer to meet the work requirement. And so, although we might prefer that requirement's not there for families, that's the system that we're in right now. And so being able to have a process for families to meet those requirements, whether it's volunteering in a pantry, at the food bank, maybe at their school, just really helping SNAP participants retain the benefits that they have, and helping them meet that requirement by offering some solutions to do that. So all of that in addition to making sure that we have enough funding to be able to pay our staff. And from the food bank perspective, looking at how we can make sure we have enough food available for our partners. We have seen at our food bank here in Eastern Iowa, we have seen a steady or increased amount of food donations coming in from our large food donors. So if we can sustain that, that will be fantastic. We also know that businesses are having to look at their bottom dollar and look at cutting waste, which could mean less food is available for our partners to have that donated food from some of our local retailers. And so, trying to get ahead of that and have those conversations with those partners prior to us seeing a decrease in that is important. And so that's some of the work that we're doing kind of behind the scenes to make sure that we have enough food available, that we can maintain. At this point, we're kind of thinking about we need to maintain what we have, knowing that the need is increasing and that we really need to increase the amount of food that we have available. So there's just a lot of variables going on that affect kind of all of those things and how it's going to all come together. And we also know that we have some really good support from the public in each of our communities. And so, everybody's going to come together to do what we can to meet the need.
Absolutely.
Yeah, and I would just add, Kim mentioned those work requirements. That's definitely something, I'm concerned about. There is a lot of evidence on work requirements showing that they don't actually, meaningfully increase employment and earnings. A lot of times it's just a barrier for folks. Even if they have an exemption, they shouldn't need to meet the work requirement. Just proving that exemption can be a barrier in itself. So I do worry, and we don't exactly know when that's going to go into effect, possibly November 1st, but we don't necessarily even have that date confirmed. And that's going to be a big change. Work reporting requirements already existed for SNAP. This just expanded who it applied to. So that means now older adults 55 through 64 are going to need to do this. Parents and caretakers of children ages 13 and up, and they removed exemptions for veterans, unhoused people, young adults aging out of foster care. So if you work with any of those populations, I think it's something to be aware of and be planning. And like Kim mentioned, there's some creative ways I think that nonprofits can think about helping people as they navigate this new requirement. Another one that was just really unfortunate to see in the reconciliation bill was some of the eligibility changes around non-citizens. And I want to be clear, undocumented immigrants are not eligible for SNAP benefits, but other forms of legal immigrants were previously could qualify for SNAP benefits. And so refugees are no longer going to be able to access SNAP benefits, asylees, other immigrants here on humanitarian grounds. And that could be a big hit for some of those families, especially if they're larger. Hundreds of dollars a month that they're going to lose for, buying groceries. And a lot of the time, as hard as nonprofits try, food banks and pantries to have culturally appropriate food, it can be really hard when you have, folks from 20 different countries of origin and having all the food items for them. This is why SNAP is just the better solution, so people can purchase their own groceries. And so I think, that is something that communities are going to need to respond to. And, we're already thinking about how do we encourage food drives for some of those items, or does it make more sense to just work with a mutual aid fund to set up, something so people can purchase their own groceries? And then another piece that wasn't covered as much around reconciliation was the elimination of SNAP Ed. And that is a SNAP nutrition education program, which I'm not really sure how eliminating SNAP Ed falls in line with making America healthy again. But, I was telling folks, SNAP Ed is not just really eliminating one program. It's like a dozen. I'm not even sure how many in the state of Iowa. That funding supports programs and staff at HHS in the state and also at Iowa State Extension and Outreach. And we know there were some people whose last day was September 30th and their positions were eliminated because of the loss of SNAP Ed funding. So that means less nutrition education in food pantries. That means less cooking classes, less recipes being created, less community gardens being grown at food pantries. And then on top of all of this, we could see a real ripple effect on school meals. When people qualify for SNAP, when they qualify for Medicaid, there's what's called direct certification. So Medicaid is another huge piece of this reconciliation bill, largest cut to Medicaid in history. If we see families lose access to SNAP and Medicaid, that could mean they will also lose access to free school meals. They might still qualify and need to fill out an application and take that extra step, or they might just be kicked off. So I think we're all very concerned about, we've already seen this really elevated need with all of these changes happening. How are we all going to be able to respond? And I think Kim nailed it. We really are going to need to band together as communities, as a sector, because we're just seeing a huge loss of resources coming from the federal and state government.
Absolutely. Did you want to add something, John?
Everything was covered so eloquently, but I again want to reiterate that we are seeing like the public safety net dismantled in real time, and that's the burden is being passed along to private nonprofits, and that's not sustainable. And I know, Emily, you had an incredible article earlier this week referencing like how is philanthropy going to fill the gaps? And the truth is just we can't. And I've told this story time and time again. I referenced earlier at Coralville Community Food Pantry, we're probably one of the better resource pantries in the state. Like we have incredible support from our loyal donor base. We have literally one of the strongest food rescue organizations in our community and table to table. We have an attentive, supportive food bank, local government that cares about the work we're doing, incredible volunteers, and even with all of that, we're struggling to meet the need right now. So what's next year going to look like? Again, it's just I don't see a sustainable path forward unless we save these programs that are facing major cuts.
Absolutely. So you mentioned, all three of you have mentioned kind of a wide variety of cuts that we've seen and difficulties that we're trying to address at this point. Walk me through the process of kind of prioritizing as you start to see that these cuts are coming down the line, that they're heading your direction. What conversations are you having within your organizations to prepare to is it just buckling down to, kind of face it, or what does that look like on your end?
Well, I can maybe start. Sorry, John, unless you were reaching for unmute. We're just trying to think strategically and trying to maybe plan for the worst, and how do we meet those gaps. I will say too, I do a lot of advocacy, and primarily that is legislative advocacy, but we're thinking more about how do we work with the department to, as they're faced with the implementation of a lot of these pieces. Our Department of Health and Human Services did not vote for this reconciliation bill. They did not vote for these cuts. They are stuck with implementing a lot of these changes. And a piece I didn't necessarily get into is some of the longer term impacts of this bill that will put a lot of pressure on the state budget. And so we are thinking about how can we, be working alongside the department, be working with the legislature to make sure that the state is investing in making changes now that are going to save us money further down the line. Because what we don't want to see is immense pressure from some of these changes to SNAP and Medicaid on our state budget that could lead to future cuts from our state legislature, not just to SNAP and Medicaid. I mean, other programs that are funded through our HHS budget could potentially be impacted from this. And so during, reconciliation, there's this whole cost share piece on the administrative costs and on benefit costs. And I kept saying a cost shift is really just shifting the blame, because there's these very unpopular cuts, and Congress essentially shifted a lot of that cost to the states. And if states can't make up that cost, we could see cuts in the future. I really hope it's not going to come to that. I don't anticipate that in Iowa right now, but I think it is a concern.
Absolutely.
Yeah, I think that's probably the most important thing we can do, besides all of the things about fundraising and getting food available and thinking about those cultural, like all of those things are important also. But Luke is right. We need to come together, and we need to work with our partners at HHS. And we, as the Food Bank Association, have regular meetings with HHS, and we've had an open door conversations about kind of a lot of these same things and what that looks like for our charitable food system, what it looks like for food banks. And I think we need to continue those conversations, and we need to dig deep into what are we really committed to, and where are our values, and how do we live into that in a way that can best meet the needs of those that are facing the struggle. And I think, we can talk about the struggles that we have in the food bank and all of that, but when it comes down to it, it's about the neighbor. It's about the person who is looking for food to feed their family at the end of the day. And I think it can be easy for us as leaders to get stuck in our own woes of our situation. But when it comes down to it, there's a person who's looking for food, and that's what matters, is how are we going to help that person find food, and all of the other stuff needs to feed into that so that we have the food available, we have policies that help families be successful. I think we can all agree that we don't feel like we're currently on the track of moving in the right direction for that. And so, how do we do that better so that we can have the supports in place that people need to be successful? And, certainly coming from a community action agency, that's something that we've been committed to since the beginning of community action 60 years ago. It's what food banks do, food pantries, all partners, nonprofits everywhere. We're really just trying to help families be successful. We want families to be able to make their own choices, pay their own bills, buy their own food, all of those things. And so how do we best have the supports that families need to be able to do that on their own? And this is the time when we need to come together as nonprofits and organizations and really think about how can we best serve the neighbor and be efficient about how we do that.
Agreed, Kim. Yeah, I think it's really unfortunate. This whole conference is designed to celebrate like the innovation and great ideas that are going to lead us towards a better, brighter Iowa. And here we are, like talking about the emergencies that have happening, and we're stuck with policymakers who are just putting forth regressive, antiquated solutions to really major issues. And so a lot of what we're doing right now internally with my organization and with our partners is contingency plans just to like stay afloat. We're talking about like, okay, if one food pantry goes down in Johnson County because of loss of funding, loss of support, how are we going to step up collectively to meet the need? How are we going to take on all these additional families that are coming from outside of our local community because they come to Johnson County for healthcare services, social services, groceries, and now food assistance too? How do we keep pace with that? And that is the challenge looking ahead. Yeah, it's going to be a heavy lift, and so yeah, we're starting to think about creative joint fundraising opportunities, but also like how do we streamline our services together? And it's unfortunate that sometimes innovation happens because of emergencies, but innovation can also happen because we all care about like the having a good outcome at the end, and so we're kind of being forced to think about delivering our services in a different way, and that's going to be really challenging.
Absolutely. On the topic of that sort of forced innovation that you're seeing now, and turning to that sort of aspect that you mentioned, John, of trying to look forward and, what are we seeing as you're facing just this complete influx of need and losing all these resources? Are there creative collaborative efforts that you've seen kind of popping up in this space yet? Or is that something that we're still sort of waiting to see where that starts to develop?
I can mention one. I'm sure others have more to say too, but just in Johnson County, there's been a collection of food access organizations, pantries, school pantries, food rescue groups. We've started Johnson County Food Action Network. So we're trying to just pair together and support each other to somewhat control our destiny as much as we can. And so that entails sharing resources, just being there for each other, sharing some professional services if we can to cut some costs, going in on joint bulk purchases again to like reduce the overall cost for everyone. We've issued joint statements on some of these policies that we've seen. And we're also planning to do some joint funding requests through local government and other private grants. So we can't afford to have one piece of the puzzle fail in Johnson County. So it's in our best interest for every food access nonprofit to stay afloat during this time.
Absolutely.
Yeah, I think these are times when people come together and look for creative solutions. And, we've seen similar things happening in Lynn County with partners working together. I know there's a group of pantries that are looking at the holiday distributions and how we can streamline for families to apply for those services, but also in receiving that holiday assistance kind of food. So there's a lot of opportunity there for collaboration among nonprofits. I think another space that we've been doing a lot of work in across the state is the health and hunger, and looking at how the foods that we have, the health of those foods, the quality of the food, the nutrition that people are getting, and certainly with the loss of the SNAP Ed program, that does change the amount of nutrition services that are provided in pantries across the state. So, as food banks, we're looking at how can we provide some of those services through our existing network. But another piece of that relates to food as medicine, and how there are various programs across the state where different nonprofits are having different veggie RX programs, veggie prescription food boxes, nutrition boxes, things like that in lots of different ways. And so we're just beginning the conversations about how we can come together. I've been involved in a work group at the national level through Feeding America and other foundations that have been supporting food as medicine work across the country, and having a lot of conversation about how we can work together and develop systems. So some states have opportunities to bill for some food and other social services through Medicare and Medicaid. And we don't have those options currently available in Iowa, but certainly it's something we've been advocating for years. And how can we continue to do that, but also come together with other folks in this space that are doing this work and develop a system so that we're ready. I think through the Make America Healthy Again movement, I think we will see some funding opportunities coming that could support some of this work that we're doing in the nutrition space. And so for us to be prepared and ready to launch something like that would be amazing for us to be able to get out ahead of that. And so we're just beginning those conversations and trying to look at what that might look like. But I think there's a lot of opportunity and a lot of commitment to that healthy food, having healthy food available in the charitable food system. So I'm excited to see where we can go with that and what we can create, being innovative and knowing that we have a lot of challenges in front of us, but there are also opportunities that we need to be prepared for to have these things ready to go. And so I think, there's a lot of things going on, but to do this work ongoing, you have to have a bit of an optimistic lens at how you look at life, or we might not come to work the next day sometimes. And so, that's kind of how we try to look at it, is we find the opportunities in what we're given and be able to react when the time is right.
Absolutely.
Yeah, and I would just lift up the Iowa Food System Coalition. I think, it's a relatively new organization, but is building on decades of work in the state around local and regional food systems. And we've seen some small wins there as it relates to local food in the state of Iowa. So the Choose Iowa Food Purchasing Program was a pilot the first year, was made permanent this year. We think there's an opportunity to continue to build that program, get schools added back in, but it's essentially money for food banks, schools to purchase locally grown food. And so I think we have some real opportunities when we're thinking about systemic change and addressing root cause issues. I definitely think about that around systems of poverty, but also within our food systems. I hear a lot about how Iowa is one of the top agriculture producers in the world. But, we're not growing a lot of food crops. And so, what can the state be doing? What can the federal government be doing to promote more small scale fruit and vegetable production? We'd love to see more of that in food pantries. We'd love to see more of that available to folks on SNAP. It's, one of the reasons it's such a barrier is the high cost of healthy food. So programs like Double Up Food Bucks that incentivize the purchase of fresh produce. I think we've got some great options. And, Kim said we may have more opportunities in the future, but man, it would be great if we didn't cancel LFPA and LFS. It would have been great if they didn't eliminate SNAP Ed. So some of this seems like 2 steps back and maybe a half step forward. We don't even know yet on some of this. So we want to be there to seize those opportunities, but also I think long term, we really need to be looking at how do we address these root cause issues. Food pantries are a Band-Aid solution. So is SNAP, frankly. Kim mentioned earlier, I think the goal here would be that everyone could afford their own food to purchase when they need it, where they need it, whenever they need it. I would love to see SNAP rolls decrease if it meant people were having their food needs met. But when we're seeing SNAP rolls decrease and food pantries, see more and more people every month, that tells me the system's not working. Or maybe it's working exactly as it was designed to.
Absolutely, yeah. We have an interesting question that has popped up in the chat here that I want to pose. It's maybe a little bit more targeted at Kim, as John and Luke, you both kind of work in larger city metropolitan areas, but it says, I was wondering how food insecurity is looking in our more rural counties, especially with the SNAP dollars gone. Is that something you can kind of address, Kim, as far as the rural?
Sure. I think I know John mentioned a little bit about it in the shift where people are going to get food. So just, I guess, first want to start with a clarification. The SNAP Ed dollars were primarily nutrition education focused. And so the loss of SNAP Ed isn't going to directly affect food availability, but yet it affects indirectly from the nutrition education side. So just wanted to make that clarification. But what we're seeing is really that people are traveling long distances to get food. So whether they're going, frankly, it goes both directions. People from Cedar Rapids going to Coralville, or people from Coralville going to Cedar Rapids. Like, we see it both ways. And even with our mobile pantries in some of the rural areas, we'll see folks from a small town drive to the next county over to a different small town to visit the mobile pantry. We assume that some of that's connected to its visibility. Like, I feel safer going to this place that's further away from my home so that I don't have to go to the place in my own town. So I think that's a part of it. But we also know that people are visiting multiple places. So, for example, in Jones County, we do four mobile pantries in Jones County, and we might see that same family at all 4 of those mobile locations in Jones County. And so what that tells us is that people are having to go to multiple places to meet that need. And we see that we don't have good data across the board that can tell us that, just because we don't have systems in place to be able to track that, track neighbor visiting the pantries across the board. But we have a little bit of that through our mobile pantries. And so we can see that people are going to those multiple places. Families shouldn't have to go visit 4 different places to get food to feed their family over the course of a month. What if they could just, first of all, like we've said, buy the groceries themselves with their equitable pay? But also, if there were greater opportunities for them to visit, say, one pantry and could get all the food that they need and didn't need to go visit multiple places. And a lot of pantries have requirements of, amount of food you can get, or visits during the course of a month or a week. And all of that is because we're trying to make the resources stretch farther to meet the need. And so we understand why that's happening. But so I certainly think that hunger in the rural area is probably a little bit more prevalent than we see in the urban areas, because we also have food deserts. Grocery, like in the Jones County example, 1/4 of the county is a food desert. There is not a grocery store people can go to, just because it's that rural and the small town grocery stores have closed. And so we see higher rates of food insecurity in those areas. And So it is prevalent. Our population is aging. We're seeing a lot of hunger with seniors, which is why we have focused programming that is solely for seniors. But everyone is affected by hunger and having to go multiple places and long distances. So it's very prevalent, and with the changes that we've already discussed, we see increases in these things before it gets better.
Absolutely.
Can I hop into real quick? Sorry. I think Kim brought up a really great point about the economics of rural communities. And I think another fear around some of these SNAP cuts, SNAP has an economic multiplier effect. And so those are dollars going into local communities. If we, see less people receiving SNAP benefits, that might have an effect on that grocery store. Also, another thing we haven't mentioned, Iowa is seeking a SNAP restriction waiver that is set to go into effect in January. So that would eliminate certain foods and beverages. It's based on the sales tax. So I think the hope is that this shouldn't be too hard for grocers to implement. But I still worry, especially for those smaller independent grocers who might not have as many resources to update their point of sale system and things like that. Could we see, and again, this is a worst case scenario, could we see retailers drop accepting SNAP entirely, or there's taking such a hit on sales that they're making decisions around their own future and finances? And then just, when we think about especially summer nutrition, that can be really hard in rural areas if there are summer food service sites. People need to drive longer to get to those. Now, thankfully, we've seen some new flexibilities around rural non-congregate options, which is a mouthful. It basically means we've added some grab and go options for rural areas so that, if you have to drive 30 miles to get there, you can pick up food for the whole week, and rather than needing to go there every day and eat on site. So that is one, I think, positive change we've seen in the past few years. And then final thought, which is what I meant to start with. We have good data on food insecurity. And part of that is because of the federal government's current population survey food security supplement. And there was an announcement a few weeks back that USDA Economic Research Service was ending the household food security report. So we're not even going to be able to have the same data that we use to measure food insecurity. I don't think that it's a coincidence that we're stopping gathering this data on hunger at the same time that we just cut SNAP by a massive amount.
Gotcha. Yeah, no, thank you for bringing that up. I think that's an important detail. In vein with that, that idea of kind of trying to figure out what's going on, having that data to collect, and sort of going back to what Kim mentioned just about people traveling so far to get this food and the people that you see. Have you been able to have conversations or kind of heard through the grapevine of those that are working more on the ground directly with folks? What are you hearing as far as, as we're seeing this increased need and more people turning up to food pantries asking for support? What are you hearing from those folks about what's bringing them to you? What's going on kind of generally that's creating this increased need among individuals?
I'll start. I know a lot of what we're hearing lately, as you might imagine, is groceries are really expensive. Utilities are up. Cost of rent is up. Johnson County's, I believe, is still the most expensive county to live in Iowa. I just heard earlier this week that, I didn't know this, one of our lowest barrier temporary, like short-term housing opportunities, it's a rental unit in Coralville, costs anywhere from $300 to $500 a week. So that's like up to $2,000 a month for an individual or a household who is on extremely limited income, if anything at all. And they have no other money to stretch for groceries or healthcare, whatever it might be. So, and we know from our own internal surveying, which we partner with Johnson County Public Health with their food security assessment countywide, close to 80% of the folks who visit our food pantry consider us their primary food source. So we're their first stop. They get the bulk of their household food needs and health items as well, before they're able to fill out the rest with either SNAP, if they have SNAP, or whatever they can afford at the local grocery store. So yeah, it's a lot of what you would probably imagine is what we're hearing. And there's certainly like folks who are new to town, it's their first time coming. Some people experienced a recent job loss or reduction in pay, whatever it might be. So they're having to turn to a food pantry for the first time, and we're always happy that they come. You know, there is a lot. Kim mentioned there's a stigma attached to utilizing your local food pantry, and it's not the most fun thing in the world to say I have to go to my local food pantry, rely on my neighbors for help. But we try to combat that narrative by talking about food as a right. Like everybody inherently deserves food, no matter who you are, whether you work, whether you don't work, can't work, whatever it might be, no matter what language you speak, where you came from originally. You deserve food just because you're alive and you live in our community. And we again do our best to permeate that message, and hopefully it's working. I hate to like talk about the silver linings of the pandemic, but like one good thing that came out of that was a lot of people ended up being in the same boat and had to turn to food pantries for the first time. So it was a little more socially acceptable, so to speak. So we're hoping to see more of that. But I will mention too, one thing that's concerning right now is we have a lot of neighbors who might have sensitive documentation status, and we're trying to find ways for them to feel safe about receiving their food services through us. So like our home delivery requests have gone up exponentially just in the past few weeks, as we've seen some action down here in Johnson County, presence from ICE. And that's something we're strategizing. Again, we don't want people to have to go without one of the most basic human needs because they are too afraid to come to our food pantry.
Absolutely.
Yeah, I think the housing piece that you mentioned is really important to make sure we highlight because, you know, especially in Johnson County, that's something that we see with our own housing units that we have at HACAP, and you know, just looking at the statistics, the number, I think it's like 80% of individuals are housing burdened, which just means that it costs so much for them to live in their home, they can't afford their other things that they need to survive. And so, you know, it really kind of begs the question of like, where does this all start? You know, we talk about root causes. It's really, when you look at it, there isn't just one place that you can point your finger to say, oh, if we just fixed this. But we know that if we just fixed housing, it solved a lot of things. Because a lot of things kind of come back to that. But certainly we do our best to try to make sure people have food because that's something we can do something about a little bit easier.
Yeah, I don't think I have too much to add. I would echo a lot of what was said by John and Kim, and just, you know, we continue to see a lot of new families as well at our food pantry network, and less and less people who are relying on SNAP, which again is not surprising just based on the trends that we've been seeing. But that means that we are needing to raise more money, purchase more food, rely on more volunteers. And so all of that, we are certainly willing to step up to the challenge. It's what we do, but we can't do it alone. And we're seeing more and more, I think John said this earlier, more and more burden being shifted to the nonprofit sector. And food insecurity doesn't exist in a vacuum. You know, Kim brought up housing. We've mentioned all these other, you know, child care costs, all these other pieces that, you know, healthcare. We just saw the biggest cut to Medicaid too. So even outside of the things we've been talking about, reductions in TFAP, cancellations of programs, cutting SNAP, we're also seeing attacks in other sectors, I would say, around housing, healthcare, and that is going to be compounding. So it's not just food banks and pantries who are going to be asking for more from our community. It's other nonprofits as well, or who are going to be facing closing their doors. And then if that happens, where do those people go? And so, you know, I think a lot of the time, you know, nonprofits, we like to just like put our heads down, do the hard work. We're not looking for like praise or recognition, but I do think we need to start getting better at talking about just the immense impact that nonprofits have on our local communities, for our economies, just as, you know, that safety net. Because we are going to see nonprofits being, again, asked to do more with less. And we're not going to be able to do it on our own. We need all your help.
Absolutely. Thank you. I appreciate that. The discussions there of just that, the intermixing of the safety nets and how those issues kind of compound together, I think is really important, especially in this kind of a discussion place where we're talking about all of these issues here at Iowa Ideas. So I appreciate those connections we're able to see there. We had another question here kind of in response to what was said before in reference to the security data collection halting. And this audience member was just wondering, have there been conversations, as that data collection is being closed, ended, have there been conversations about what next steps there might be in Iowa to be able to maybe to continue to see that data or capture what's going on in food security, something we can do here to continue that ourselves?
Yeah, I think there's a lot of work that's happening individually. It's certain, John referenced Johnson County Public Health, Food Insecurity Survey, Lynn County Public Health does that. Community actions across the state are looking at needs assessments as well. I think that as we look at how we can kind of fill that gap, I think that's something that we need to consider from just with our network through the Food Bank Association, all of our partners. How can we best collect data that we can compare across streams? So I know we started a conversation just between Lynn and Johnson County Public Health is if we could use the same survey, but even kind of taking that bigger than that across the state, if many counties are doing these surveys, why can't we all work together to have a similar survey so that we can collect that information and compare it? The other thing I know that through the Food Bank Association that we did earlier this year was a survey that was a phone survey that went out that we did get some pretty good feedback on that could help us. We could replicate that to be able to compare our data from year to year, but really asking Iowans, do you support these programs like SNAP and summer EBT? And overwhelmingly from across the board, from different parties, people are saying, yes, we support these programs because I think it comes back to that thing about how food is the most basic need and we want people to be able to eat. So I think there's a lot that we could do in that space and collaborate to bring that together. And I'm happy to be a part of those conversations.
I'll just make a quick pitch and I'll let Luke chime in with more if he'd like to, but Luke has worked incredibly hard to compile a lot of really helpful SNAP data from the past decade and a half that lives on the Iowa Hunger Coalition website. You can go to the SNAP map and you can, again, get all this incredible hyper-local information about who's enrolled in SNAP, average benefits, and see the trends over the past, again, decade and a half. You can look at it by county, by congressional district. That's been a really useful tool. It's obviously not the whole picture, but it's, again, paints how important that safety net has been.
Absolutely.
Well, thanks for the SNAP map plug, John. But I think you're right. It doesn't tell the whole picture because we know, SNAP enrollment is generally down in the state, although that's not true for every county. So check out your county. But I think that's why we need things like these food security surveys. And I think Kim is right. Like most counties, I think every county maybe is required to do a community health needs assessment or something through the hospital. I'm not an expert on this. I shouldn't have said anything, but I know a lot of counties do these community health needs assessments. Make sure you're asking one or two food security screener questions. And yeah, if it can be the same question in every county, perfect, because then we can make that comparison. So absolutely, if you're working for a county, especially public health, be thinking about this and reach out to other counties.
Absolutely. Well, we are nearing the end here. So I have one last question that I want to make sure we get to. And then if, depending on how long we take, we might throw another one in there or close up. But I did want to make sure before we end that we can just put this out there. If someone is in need of these food services, what are your guys' recommendations? Where should they start? And then what should they be expecting as they start to try and navigate this system?
I would say one way to find access to food is to go to your food bank. If you're not sure who your food bank is, you can go to the Food Bank Association website that will direct you to your food bank. It's iowafba.org. That will take you to your food bank, and all of the food banks in Iowa have maps of all of the partners that are providing food out to individuals. So that would be a great place to start. 211 is always an option. There's a lot of different ways you can get connected to the system, but I think resources from person to person is always really popular. Ask your friend because they probably know and can help you get connected to some food.
I would just add, something we're thinking about at DMARC is how do we do more SNAP application assistance, help people get signed up for the program, help them when they have questions about losing their benefits. So I would say I still encourage people to sign up for SNAP. The Iowa Food Bank Association operates the SNAP hotline. So you can call that number. Someone will walk you through getting that application filled out and submitted. And so, I would encourage people apply for the benefit programs that you qualify for, whether that's SNAP, WIC, free and reduced price school meals. These programs are here for you. You pay taxes. This is a taxpayer funded benefit. So please don't feel ashamed to submit a SNAP application, to turn to a food pantry if you need help. That's why we're here. We want to help.
Absolutely.
I was going to say something really similar, but I wanted to add, like, once you're in the door at your food bank or food pantry, it's usually a no wrong door opportunity. So, like, if you have other needs, ask questions, and we can make referrals to housing assistance, utility assistance. I know HACAP will be plugging their LIHEAP program here, which is, we're getting into cold weather. I know it doesn't feel like it, but that's an essential service that people need. And we do our best to, again, refer to other social services or nonprofits to kind of meet the whole amalgam of needs that households might be experiencing.
Absolutely. Well, I think we could probably keep talking about this for another 3 hours if we were all stayed on here, but we are getting close to needing to close. Let's do one more quick question. Just generally out to the audience members, those watching, what can community members do at this point in time to support and to help with filling those seemingly endless gaps that we're seeing?
I think there's a lot of ways you can get involved. I would say find where your local pantry is. That's the best way to get involved. Find out what they need help with. Do they need food donation? Do they need dollar donation? Do they need volunteer time? There's a lot of ways to get involved across the state in lots of different ways. I will say that through food banks and our food bank network, we have the ability to buy food at really great prices. So dollars to the partner or dollars to the food bank are going to go further than the jar of peanut butter, but we'll take your peanut butter too. So just thank you to everybody who's involved in there. Find your local person and get involved.
Absolutely.
Yeah, I'll echo that. I think I was just talking with my staff about this yesterday. Like, there's a feeling things are so chaotic in the world right now, and a lot of people just want to help, but they don't know how. And it's our responsibility to communicate that. So it sometimes is as simple as, "Hey, we need peanut butter. Just bring us a jar of peanut butter." Again, get your foot in the door, and we can talk about, "Hey, is there more you want to do as a volunteer? Do you want to start, helping us behind the scenes or on the front lines? Do you want to start talking about how to advocate for better policies, get involved with the Iowa Hunger Coalition, etc." But yeah, it's easy to just be frozen and paralyzed and just like, okay, what do I do? But hopefully, again, we can provide opportunities for our neighbors to get involved in some really meaningful work.
And you can probably be doing something you're very passionate about while you're doing that. I know a lot of the times when we think about volunteers, it's helping out at the pantry or things like that. But food banks, food pantries also can really use very skilled volunteers, whether that's web design or creative design. So just ask. I think it's always worth asking, reaching out and say, how can I help? Maybe you really love to garden and you've got more produce than you know what to do with. We will absolutely take that food. And folks really enjoy having that fresh produce at food pantries too.
Absolutely. Well, thank you guys so much for your time, and thank you to our audience members for tuning in to participate in this conversation. I appreciated the questions that were sent in. I think this has been a great start to our Iowa Ideas event. We're now a few sessions in. Hopefully people can stick around and enjoy or learn a little bit more from our other speakers that we have today. Our next session on the Human and Social Services track will begin at 1:55, so just before 2 o'clock. So we'll have a little bit of a lunch break first, and that is the Mobilizing When You Feel Minimized nonprofit advocacy session. And I think that definitely ties in with a lot of what we talked about here. So definitely tune in if you've got the time and you can. So once again, thanks to our presenting sponsors, ITC for sponsoring this entire Iowa Ideas event, and to Four Oaks for sponsoring our Human and Social Services tracks. Thanks, everyone.